space medicine as a concept is necessary but not sufficient for taking care of people in space. But there have been some medical events in space that are significant. We train emergency medicine doctors on the principles and the practice of space medicine. When we're talking about that initial adaptation phase, the thing that which is most challenging for us in general but the one which I think I am most concerned about personally is
Welcome to the Omar Al-Aili podcast, your go-to podcast for exploring the diverse fields driving space exploration and technology. I'm your host, Omar Al-Aili, and today I'm thrilled to be joined by Dr. Kris Lehnhardt, a physician-scientist, a professor of emergency medicine, and the inaugural director of space medicine at the University of Texas Health Science Center, Houston. Dr. Lehnhardt previously led NASA's Exploration Medical Capability Element, essentially designing the medical system for future Moon and Mars missions. Kris, it's great to have you on the podcast today. Thank you so much for making the time.
Thank you, Omar. It's my pleasure to be here.
Kris, most of us understand emergency medicine as the critical care delivered in the ER, a world of high stakes and rapid decisions. You've taken that expertise from bustling level 1 trauma centers to the desolate quiet of Antarctica and the planning rooms for missions to the Moon and Mars. For you, what is the fundamental essence of emergency medicine, and how does that essence transform when the emergency room is a tiny capsule millions of miles from Earth?
So emergency medicine, we often say that when someone presents to the emergency department, that's probably the worst day of their lives. And so we deal with all manner of problems. And I think that what we love about emergency medicine is that variety, is the amount of the stress, if you will, but also the amount of impact you can have immediately on someone's life and hopefully dealing with whatever their illness or injury may be. But emergency medicine, as you said, it requires a hospital. It requires all of these capabilities and all of these people. And the challenge that we have in spaceflight, which is what's of particular interest to me, is how do we take the medicine we practice in the hospital and how do we push it out into the field, into places where it's needed when people can't return to the hospital for their care. So I love the idea of every type of extreme environmental medicine. And my particular interest is space medicine, but there's lots of applications here in terms of wilderness medicine, disaster medicine, military medicine. So it's improvisation and it's taking our hospital and taking that care to wherever it needs to be.
Okay, you recently taken the helm, as I said before, as the inaugural director of the space medicine at UTHealth Houston. This is a significant step for the field. What's your vision for this new role and the department? And what kind of interdisciplinary bridges are you hoping to build? And what unique contributions do you see UTHealth making to the future of human health in space?
I think that what we're trying to do at UTHealth Houston is look at space medicine and space health from a truly interdisciplinary perspective. And so I'm part of the medical school at the university, but we also have schools of nursing, bioinformatics, dentistry, psychology, and all of these fields and all these areas have the potential to have an impact, a positive impact on human health and performance in space. And what I'm looking to do as the director of space medicine for the university is find all of the ways that we can integrate those different disciplines together. And very much the way that we take care of people in the emergency department, I may be the physician seeing someone, but I can't take care of them without the nurse. And I can't take care of them without someone from psychiatry or someone from dentistry or all these different fields in different areas. So we really want to look at this from a holistic perspective, from an interdisciplinary perspective, and find ways that we can use all those different fields and domains to work together to improve human spaceflight.
Great. To bring our audience up to speed, space medicine is often defined as the field studying how spaceflight affects the human body and developing ways to keep astronauts healthy. But beyond this textbook definition, from your vantage point, how would you define space medicine for our audience that come from different disciplines?
I think that the space medicine term is useful because everyone understands what medicine is. And using some NASA speak, I would say that space medicine as a concept is necessary but not sufficient for taking care of people in space. And so the I think that more broadly, what space medicine really is it's human health and performance in space. And the reason that that distinction is important is because the people in space right now, especially if they're government astronauts, they have jobs to do and they have to be performing at a very high level. And if all we do from a medical perspective sometimes is take care of people who are sick and injured, then that's necessary for human space flight, but it's not sufficient because there's so many aspects of their health that need optimization, that need assistance, that need care enable them to then perform their tasks well. And so a more holistic approach to space medicine is what do people need in space from a health and performance perspective? And how do we design our vehicles, design our missions, create our future space endeavors in a way that supports that health and performance and ideally optimizes it so that they can best accomplish the tasks that they're there to do.
How has space medicine's scope and goals evolved since the Mercury mission of the 1960s, and where is it headed today?
It's I think right now is a really exciting time in space medicine because we are now on the cusp of lots and lots of people flying to space. And so for all of the space nerds out there like me, this has been the thing that we've been waiting for decades. And we're now finally there. And if you look back at the original missions to space, they were very, very narrow in terms of who they would allow to fly to space. So in the US in the beginning, it was nothing but men. They wouldn't even allow women to fly to space. And it was the Russians who flew the first woman to space. But all of those initial astronauts were also all test pilots. And they were, in general, exceptionally healthy people. And NASA and other government agencies generally select really, really healthy people to fly to space. But over time, the aperture has opened, and we obviously now fly lots of different types of people to space, not just test pilots. But government agencies in general are still incredibly selective about who they fly to space. And so historically, space medicine has been about preventative medicine and about occupational medicine. And that is critical to the success of our current space endeavors. However, the future is lots and lots of people flying to space. And if we're going to do that, we're going to fly lots of people who probably have lots of money. And in the beginning, those people are going to have a lot more wealth than health. And so what we have to figure out is how do we fly people with medical conditions to space? In the past, they would simply be screened out. So prevention and occupational medicine is critical for government space activities. And we want to prevent bad things from happening in space. But we now have to start finding ways to take people who want to go to space, can go to space, have the means to go to space. How do we figure out what their health problems are that are going to be exacerbated by the space environment? How do we optimize their health on Earth before they go to ensure that they have the best possible experience in space? And then if and probably when they develop a medical problem in space as a result of one of their underlying medical conditions, how do we ensure that we have the knowledge, skills, abilities, and capabilities to treat those medical conditions in space or bring them home quickly.
Okay, then there's emergency space medicine, which sounds like a specialty within a specialty, dealing with those unplanned acute events in an environment where help is anything but close. Could you share an anecdote or a hypothetical scenario that vividly illustrates what makes a medical emergency in space so uniquely challenging compared to one on Earth?
Yes, absolutely. There are lots of different potential medical scenarios in space from an emergency perspective. Now, I will say that at least up until now, there have not been a significant number of medical emergencies in space. Part of that is a testament to the selection and the prevention that we do right now. But there have been some medical events in space that are significant. And the one of the ones that people may be familiar with if they enjoy space history or space movies is in Apollo 13. On the way home, one of the astronauts developed a urinary tract infection, and it's believed that that urinary tract infection, that bladder infection, was spreading into their blood and they were becoming very sick with something called sepsis. And part of the reason that developed is because when they were doing urine dumps from the vehicle, they were actually changing the vehicle's trajectory. So
Okay.
they decided that the best thing to do would be to stop peeing as much as they could. And that in turn may have led to the development of a bladder infection. So
Wow.
it's an interesting example of where there was an operational constraint, and because they tried to address that in a particular way, they ended up with a medical problem. And because it developed on the way home, it was easy to deal with once they got back to Earth. But there is some evidence to suggest that the type of infection they had may not have been successfully treated by the antibiotic that they had on board for that mission. So if they had not been on the way home, they could have become very significantly ill. And so that's the type of scenario that we look at a lot from a space medicine perspective is bladder infections are more common in space than some other types of infections. They can lead to kidney infections, which then lead to blood infections. And how do you develop all the medical capabilities you need to treat a sick person with a blood infection in the deep space environment? That's an example of where we try to use emergency space medicine protocols and procedures to best determine how we're going to manage that type of scenario.
Amazing. Kris, UTHealth Houston runs one of the only space medicine fellowships in the USA. What's the most surprising thing you've seen a fellow learn, develop, or invent that gives you hope for the future of human space exploration?
So our program is somewhat unique. You're right. There are not a lot of space medicine training programs in the U.S. or frankly in the world. And what we do is we train emergency medicine doctors on the principles and the practice of space medicine, and they do that over a 2-year period. And one of the rotations that our fellows do is they work directly with commercial space companies, and one in particular that they work with is designing a commercial space station. And so it's a great example of how you can look at medicine and health from a more holistic perspective. Because one of the examples I saw recently when I was visiting the facility was that our doctor, our fellow, was working on a novel exercise capability for spaceflight. And one of the things that we know about human spaceflight is that through our adaptations in our bodies, we have muscle and bone breakdown, and exercise has been shown to be critically important in maintaining health and performance in space. And so having our fellows be able to take their medical knowledge and apply it in that more holistic health perspective from novel exercise devices or protocols is a really cool thing that our fellows get to work on.
Could you, I want to follow up on this question. Could you briefly touch upon why interdisciplinary approach is not just helpful, but absolutely fundamental to solving the medical challenges of living in extreme space environments?
Absolutely. I think this is such a critical point, and so I'm glad that you kind of asked this follow-up question. The reality is that, at least historically, medicine and health have not been at the forefront of design considerations for vehicles or missions.
Hmm.
The easy example is the Orion spacecraft. They have been allocated essentially a tiny little locker on the vehicle, and they've been told you can put whatever medical stuff you need to in that little locker. And that design approach means that you don't get to optimize your vehicle from a human health and performance perspective. And so, what the future looks like, and what some of the work that I did at NASA was focused on, was how do we look at medical systems and crew health and performance systems from a truly interdisciplinary lens. And the way we did that in exploration medical capability was our team was made up of doctors and scientists and engineers who were all working together to design future medical systems. And the specific example that I'll give you here relates to medical oxygen. So right now, if you want to give someone oxygen in space, we have dedicated tanks of medical oxygen that they could use. But the future of an integrated spacecraft, especially one that's doing deep space missions, you can't resupply oxygen to the vehicle if it's in deep space or on the way to
Hmm.
Mars. So you have to be able to have all of your onboard oxygen available when you need it. And you have to be able to interface with those oxygen systems on the vehicle in a way that allows you to then deliver that oxygen to a patient. And so this is where vehicle and system interfaces come into play. And so, from a medical perspective, I don't care where the oxygen comes from. All I know is how much I need to give and when I need to give it. But from a vehicle and a system design perspective, there's all kinds of interface needs that you have to address to regulate the flow of oxygen to the patient so it doesn't come at them like a garden hose. So the other problem, of course, with oxygen is that you have the possibility of flooding the vehicle with oxygen, which then increases the flammability within the
Flammability.
vehicle.
Hmm.
So some of the solutions that you can work on are, not only could you interface with the vehicle to get oxygen from the vehicle oxygen systems to the patient, but perhaps you have devices like oxygen concentrators, which
Hmm.
then scavenge the excess oxygen that leaks into the rest of the vehicle from the environment and then feeds that oxygen back into the vehicle systems so that it's not wasted or purged in any way. And so
Okay.
the ability to have the engineers and the doctors working together on those system designs, I
Hmm.
think is a critical need for future systems. And it's not historically the way that these types of systems have been designed, but it's that interdisciplinary nature of design, I think in the future is going to be critical for our success.
I just need to also linger again. Medical oxygen, is it just the difference between it and the oxygen collected, let's say, in the environment control and life support system? Is it the density of of the oxygen, or?
It's exactly the same oxygen. It's just if there isn't a system to interface with the vehicle systems, then you have to
Mhm.
have a standalone medical system. And that duplication of effort is not the way that you optimize mass, power, and volume on deep space vehicles, for example.
Gotcha. Okay, let's talk about now the human body as a system and how
Hmm.
spaceflight stress tests it. NASA outlines 5 hazards of human spaceflights: radiation, isolation, distance, altered gravity, and hostile closed environments. As an emergency physician and as a NASA medical officer, when you look at this list, does one hazard particularly jump out as the most likely to precipitate a sudden life threatening crisis on a long duration mission?
It's all of the hazards have are important for various different reasons on missions, but the one which I think I am most concerned about personally is the distance from Earth one. And the reason that that one is a big challenge that has to be overcome is that from a medical care perspective, right now on the space station, if someone on the space station develops a significant medical event, we can evacuate them and have them back on Earth in less than 24 hours. If we run out of something, if we use up all of it, if something goes bad, if something breaks, we can just resupply the vehicle. And we have almost continuous 24/7 communications with space station. But the moment you introduce distance from Earth into the equation, your evacuation potential decreases, your resupply potential decreases, and you start introducing communications delays. And that's where the austere medicine part of spaceflight comes into play. So, from an emergency medicine perspective and a medical care perspective, the distance from Earth problem is one that's going to be particularly hard to solve, especially for a mission to Mars.
Okay. Microgravity is the most alien aspect of space for the human body, triggering immediate fluid shifts, the puffy face, bird legs phenomenon, and triggering a cascade of adaptations. From an emergency planning perspective, what are the most critical acute physiological changes driven by microgravity in those initial hours or days that could rapidly escalate into a medical emergency if not anticipated or managed correctly?
Yeah, I think that it's really interesting when you talk to astronauts. Some astronauts really like microgravity, and some do not enjoy microgravity as much. But I would say when we're talking about that initial adaptation phase, the the thing that which is most challenging for us in general is space motion sickness. And the in some of the early missions that we were flying to space, because there was such a small volume that they were moving around in, the incidence of space motion sickness was very low. But once we started dealing with Apollo and then Skylab and then moving on to shuttle and space station, as the volumes get bigger, um, people can have more and more space motion sickness. And if we don't anticipate this before it happens, and then we have critical operational needs that have to happen in the beginning of a mission, if someone is incapacitated by the space motion sickness, then they cannot accomplish those immediate needs. And so, an interesting example of this, you can read about it online, is there was a recent SpaceX commercial mission called From2. And shortly after launch, everyone on board was incapacitated from space motion sickness. But the good news is that the Dragon flies mostly autonomously.
Mhm.
So no one had to perform any mission critical operations in that short period of time. But if
Mhm.
they had, they might have been unable to do so because of that. So the we know that we are going to have this introduction to the microgravity environment. We know that it can have all kinds of different impacts on people. We have to anticipate all of those events, and we have to then try and prevent or treat them if they do occur.
Chris, the cardiovascular system quickly deconditions in space with changes to heart muscle and blood volume. If an astronaut on a Mars bound spacecraft were to experience symptoms of a common cardiac emergency like an acute arrhythmia or chest pain, how do these space induced cardiovascular adaptations complicate your diagnostic process and treatment options when you're operating with limited tools and no immediate backup?
It's a fascinating question because the reality is we don't know how that type of exposure is going to affect them from a cardiovascular perspective. So a Mars mission is a great example of something where there are a number of unknown unknowns, if you will. And so We now have experience on space station of people being there up to a year, approximately. And we have been able to see how people adapt over that period of time. Any Mars mission that we anticipate is 2 to 3 years in length, depending upon the mission architecture. And we have no idea how the human body will adapt to microgravity for that period of time. So the reality is that we don't have enough time in space to really understand what that adaptation looks like. And we have almost no time in space from a deep space perspective. And the reason that I bring up the deep space perspective is because the radiation environment in deep space is substantially different from what we experience on the space station. And we know that radiation effects on the heart can actually speed up the process of heart disease. So, deep space exposures for extended periods of time might actually increase the likelihood of heart disease. So, if someone were to develop chest pain on the way to Mars, there might be an increased chance that that is a heart attack or something like a heart attack that would be a condition that we've never had to face in spaceflight before. So the the ability for people to live and work in space for extended periods of time, and then ideally in deep space for extended periods of time, will give us more information about how the body adapts, and we can use that information to anticipate those medical needs on a Mars mission. But right now, there's just a lot of open questions for that type of mission.
Okay. Similarly, we know about the use it or lose it principle for muscle and bones in space, leading to atrophy and demineralization. Beyond the long term risks of fractures, how does this musculoskeletal deconditioning actually impact an astronaut's ability to, say, perform a physically demanding emergency procedure or even just move effectively during a crisis?
It's I think we've learned a lot on our time on space station about how to maintain bone mass, muscle mass, and improve cardiovascular health. And we've been able to do that through some pretty rigorous exercise protocols, lots of advanced exercise equipment, and some some very good nutrition that we've been able to develop and use for astronauts on the space station. So our ability to now bring people back to Earth in good physical condition is significantly better than it was in the past. However, when we think about a Mars mission, for example, one of the challenges that we have is that when astronauts return to Earth in a deconditioned state, there's a team of dozens of people there to greet them, to carry them out of their vehicle, to help them perform all of these tasks. When they land on Mars, there is no one there to help them. And in some of the early designs for one of the design reference missions that NASA was working on, there was a plan to require a spacewalk within the first day or two of landing on the surface of Mars to basically plug your vehicle into a power supply so that you'd be able to maintain all the systems on your vehicle. Otherwise, you might die. And the moment that we heard about that idea, nobody who flies to space station would be capable of coming back to Earth and then entirely on their own performing a spacewalk and doing a critical mission task in that period of time. They would be much too deconditioned. So I think that the reality is that if we are going to send people to the surface of Mars and then expect them to do things on the surface of Mars in a timely manner, then we are going to have to do everything we can in flight to optimize their health. And so that's going to include exercise and nutrition, but it's also going to include probably a lot of conditioning type activities to help their balance and coordination systems, um, to enable them to be able to perform tasks in a meaningful way. So we're getting very good at maintaining muscles and bones and hearts in general using lots of exercise and good nutrition, but sending people to Mars and then asking them to land and perform tasks after 6 to 9 months in microgravity is the type of challenge that we have never even tried to face for anyone returning back to Earth.
Okay, let me linger here a little bit more on the same subject of musculoskeletal deconditioning. What kind of unexpected injuries become more probable in that state?
So to date, we have never seen anyone break a bone in space. And that is because most of our spaceflight experience has been either short duration or they've been in microgravity for a long time, but they're not exposed to the types of forces that are necessary to break a bone in space. When we look at people who may spend 6 to 9 months in microgravity and we model the changes to their bone that can occur during that time, and we then look at the types of activities they may have to perform on a celestial body, so whether it's the moon or Mars, and they're dealing with reduced gravity environments, but big, bulky, heavy spacesuits, there's all kinds of different types of broken bones that could occur. And so some of our modeling shows that people could break bones in their back, they could break their hips, they could break their wrists. And dealing with a broken bone in space is something that we've not experienced before. And we don't really have significant capabilities in space to try to deal with that type of injury. And so on Earth, if you fall and you break your wrist, you'll come to my emergency department. We'll do an x-ray. If it's broken and it's out of place, we'll give you some medicine to make you sleepy. We'll put it back in place. We'll put a cast on it. And then you might need surgery to treat that broken bone within the next week or two. If you're on the surface of Mars, how do we do
Yeah,
any of that? And there's no way to come home again in that event. So
even on
the
the surface of the
challenge,
moon.
yes, exactly. So even if this were to happen on the surface of the moon, it would take a minimum of probably a week-ish to get home, based upon where your vehicle is in orbit and timing and getting back to Earth and all these different types of things. So the the if we can prevent that type of deconditioning, then we can reduce the likelihood of that type of event from happening. But if it does happen, the consequence could be very high. And what types of medical capabilities can we have on board to try to treat that problem as best as possible in those circumstances? So that's another great example of emergency medical care from a spaceflight perspective.
Um, you've overseen research into resuscitative exercise devices on the International Space Station. Which countermeasure surprises you by working or failing in orbit?
So I think that one of the things that we have found in orbit is that the the ARED device that they use right now for resistance exercise is very effective at maintaining bone and muscle mass. But it is an enormous piece of equipment, and it is a very complicated piece of equipment. And the challenge that we foresee for future missions is that there won't be the mass and volume necessary for that type of equipment to be there. So how can we miniaturize that equipment and find alternate ways to maintain that bone and muscle mass? And so there are a number of different technologies that have been developed, and some that are being flown to space station and tested in the deep space environment. But we need the ability to maintain muscle mass in space. And the treadmill and the cycle are wonderful from a cardiovascular health perspective, but they are not sufficient for maintaining true function and strength necessary to perform a lot of our tasks in space and maintain overall health. So resistance exercise has been truly transformative on the space station, but that capability is going to be very difficult to fly in deep space.
Okay. Spaceflight associated neuroocular syndrome, or SANS, otherwise known as space fog, has emerged as a significant concern, with astronauts experiencing vision changes due to fluid shifts and potential increases in intracranial pressure. So let me ask you, if an astronaut suddenly reports severe headache and blurred vision, how would the medical officer differentiate a SANS related crisis from something like a stroke or other acute neurological event, especially with the diagnostic limitations of a space mission?
It's a it's a it's a very challenging problem. I'll be frank. You're right. We have no ability to perform a CAT scan or an MRI in space today. That technology does not exist. And without those diagnostic tools, we we cannot do the types of investigations that we would typically do on Earth. So we have to think about unique ways of dealing with that. Now, uh, a stroke typically will present with a number of different neurological symptoms, and there are some physical examination ways that we can try and determine that event. But raised intracranial pressure, as you mentioned, is
Hmm.
very difficult for us to measure in space. We've never done a test in space called a lumbar puncture, where we actually take fluid from the spinal cord and we can measure the pressure in there. There are some technologies that look at using ultrasound to try and determine what intracranial pressure is by looking at your eyes. If you've suffered a traumatic head injury and there's bleeding in the brain, there are some technologies looking at your brain waves that can try and help to make those diagnoses. But our typical imaging capabilities are not something that we anticipate having anytime in the future in spaceflight. Someday, perhaps, but not certainly not in the near future. So that diagnostic uncertainty is
Hmm.
absolutely going to be a fact of what we deal with on deep space missions. And
Hmm.
having people on board with medical knowledge or experience or training, I think will be critical in trying to make the right diagnosis in those circumstances. But it's going to be done with imperfect and limited information.
Have you ever had to make a split second decision because sensory inputs in space betrayed an astronaut's sense of reality?
Yeah, so I can't say that I've had that experience. I do know that there are protocols in place for people who have psychological adaptations or other sensory adaptations in space that I think we would say are maladaptive.
Hmm.
And so I think that there certainly are stories from previous missions, like some of the Russian space station missions back in the Soyuz days, um, of people who were suffering from some mental health challenges. So I think that there are certainly a number of different conditions that we have to anticipate in spaceflight. And one of the projects that we worked on in exploration medical capability was developing a trade space analysis tool for medical conditions. And so what we were trying to do was determine the most likely conditions and their consequences, and then all the medical resources and capabilities necessary to treat those conditions. And so all of the spaceflight adaptation conditions, as well as a number of mental health conditions, were on that list because we have to take into account the possibility of those conditions occurring and know that we have abilities in place in our medical system to address them.
The compensatory reserve index has revolutionized battlefield medicine by predicting shock before vital signs change. Chris, when you first proposed applying the compensatory reserve from military field care to spaceflight, where astronauts can be weeks away from a medvac, what was the most surprising physiological insight you uncovered?
I think that the really interesting thing from that concept is that a lot of times in medicine, we kind of wait for something bad to happen and then we address it. And the idea of looking at that reserve as a measure of shock, the idea was to try and identify a shock state that was about to occur before it occurred so that you could stop it from occurring. And I think that that as a concept is critical for human spaceflight. Wherever we can, if we can, we want to identify a problem before it happens and then stop it from happening. And the idea there is not only is that beneficial for the health and well-being of the astronauts, but it's also beneficial from a mission perspective. It may mean that you can still accomplish some mission objectives that you couldn't accomplish otherwise, or it may mean that you can preserve resources that you would otherwise use if you waited until someone got more sick, but you'd had to use less resources to prevent them from getting sick. So that ability to see something bad coming before it happens and stop it from happening, it's a critical concept in space medicine. And this application from battlefield medicine of looking for other ways to identify a shock state before someone's blood pressure drops, for example,
Mm-hmm.
is a really good scenario to demonstrate how advanced monitoring of health can assist us in maintaining the well-being of the astronauts going forward, but by stopping bad things from happening before they do.
Building on that, how do you envision compensatory reserve monitoring reshaping autonomous health surveillance on deep space missions where ground support may be delayed by minutes or even hours sometimes?
I think that there's lots of different things that we can measure about the human body. And the challenge that we have every time we take a new measurement is, what do we do with that information? And when you have technology that can take real time, second by second, or even faster measurements of different physiological parameters, or even things as simple as, I'm wearing a Fitbit right now, my heart rate, the all of that data and all that information is available for use, but we as humans can't ingest huge amounts of data like that and then make a meaningful interpretation of all of that information. But computers are excellent at that task. And so I think that in the future, if you were to look at the types of parameters that we can monitor in people, and you were to look at advanced computing tools that can real time analyze huge amounts of data on each individual person, we can then develop new tools to identify those problems before they happen and before they occur. And so this is one of the areas where I think that AI technologies are going to be incredibly helpful. Even just from a normal hospital perspective, if I'm taking care of 20 or 30 patients, I can't be looking at all of their data simultaneously, but AI tools can. And then they can alert me to a problem that I can then go and intervene and fix. So I think that that real time monitoring capability, the real time analysis and integration of all of that data is
Mm-hmm.
going to allow us to identify those problems as they're happening or before they happen so that we can then intervene in a timely manner. And so that compensatory reserve concept is one where you're trying to take data and analyze that data and identify a problem before it's happening. And I think that that general concept can apply not only here on Earth in lots of different ways, but has many spaceflight applications as well.
As we push beyond low Earth orbit, reliance on Earth based care becomes untenable. You were pivotal in leading NASA's exploration medical capability element, as you were talking about earlier, focusing on Earth independent medical operations, or EMO. Is it EMO?
We say IMO, but
IMO.
either
Okay.
one's acceptable.
For our audience, many of whom are scientists and engineers, what are the one or two most critical technological or even procedural hurdles that still need to be overcome to for true IMO to be a reality for a lunar or Mars mission?
Yeah, it's this is probably the project that I worked on that I think is the most revolutionary and fascinating. The right now, in terms of our care in space, like you said, we're very Earth dependent.
Hmm.
And the future of human spaceflight is, by nature, it has to be Earth independent. An example that I always like to give is that there's a there's a possibility during a Mars mission of the sun being between the vehicle and Earth. And if that occurs and we don't have a workaround, you cannot communicate during that time. So that's solar conjunction, and that can last up to 2 weeks. Um, we we have very rarely ever had people in space where we could not communicate with them on a regular basis. And so, if you were to talk to most people at NASA and say, for the next 2 weeks, nobody can talk to space station, um, they would lose their minds. But that could be the reality of what a Mars mission looks like. And so, from an EIMO perspective, I think there's two main hurdles that have to be overcome. One is the the desire or the need for people on Earth to always know what's going on, because that's not going to be the reality of the future. So there's some cultural and operational changes that have to happen so that the vehicle and the people on board can become more autonomous.
Hmm.
But the other part of it, from a technology perspective, is we have to find a way to integrate lots of different data streams that have never been integrated before.
Okay.
And so, if you think about this from a, a crew health and performance perspective, there's health data, there's environmental data, there's performance data, there's all kinds of data from the vehicle about its onboard systems. And each one of those technologies and capabilities, they are, in most cases, silos. They are
Hmm.
individual data streams and they do not communicate with each other at all. But if you're going to have Earth independent operations and you're going to have decision support tools on board the vehicle, especially
Hmm.
ones that use artificial intelligence, those data systems require lots and lots of information, and they need easy access to that information, and it all needs to be integrated in one place. And so, if there's information about what I ate yesterday and how I slept last night and how many times I went pee and what my exercise was like and what my health is like and all these different types of things, the decision support tools and the AI tools that are on board have to have all of that information and be able to integrate all of that information in a meaningful way. So when an astronaut comes forward and says, I have a headache, could just be a normal headache. But if everyone on board has the same headache and you can't get access to the vehicle environmental data, then you can't tell that the carbon dioxide level is really high in the vehicle because one of the scrubbers has failed and there's no alarm that went off because the system isn't working properly.
Okay.
Without all that information, you can't make a good decision. So the integration of lots of different systems and lots of different data streams is pivotal to being able to perform in a truly Earth independent manner. And right now, all those data streams and all that data gets sent back to Earth.
Okay. Even the most advanced pharmaceuticals can degrade unpredictably in orbit. In examining medication stability aboard the International Space Station, which class of drugs surprised you most by losing potency, and what chemical or environmental mechanisms drove that decline?
So it's a really interesting question because there have been some studies that have shown that medications do degrade faster in space. There have been some studies that show that medications are relatively stable in space. But what we've determined through some of those studies is that in many cases, it wasn't something that was necessarily unique to the space environment that was causing them to change, but it was the way that we were repackaging those medicines for spaceflight. So
Okay.
we oftentimes will take medicines out of the manufacturer's packaging and put them into smaller packages for mass and volume savings. But by doing so, we expose those medicines to the environment. And so the common things that cause medications to break down, light exposure, carbon dioxide or oxygen exposure, moisture, things like that, those all influence medicines in the same way in space as they do on Earth. So the way we package medicines for spaceflight is going to be critically important for their stability going forward. But one of the analyses that was recently done looked at how radiation may impact medications in deep space. And what that study found was that medications in a solid form, so pills, tablets, capsules, things like that, those are relatively stable even with a significant radiation exposure. But a bunch of the medicines that we fly to space are in aqueous forms, so liquids, creams, gels, things like that. Those medicines are much more susceptible to radiation, especially deep space radiation. And we've not been able to date to be able to study any of those medicines in a meaningful way in a deep space radiation environment. So future studies that look at aqueous forms of medications will be important from a radiation perspective because they have the potential to break down substantially.
If I may linger on that a little bit more tangentially, is the absorption rate of medication in the human body, does it change in space than on Earth?
We don't know the answer to that question, to be perfectly frank. We know that medicines change in space. We know that people's bodies change in space, but we don't know how the changed medicines and the changed bodies interact with each other. And so this is an area of study which is pharmacokinetics and pharmacodynamics. And while I was at NASA, we were working on a research strategy specifically for pharmacokinetics. And that research strategy is hopefully going to be published here in the near future. But there is an opportunity going forward for some of that work to be done in some pretty novel ways. There are lots of different new modeling softwares that we could use that could try and create a digital twin, if you will, for the human body in space as it changes, and then study the way that medications interact with changed that changed digital twin. But there are also opportunities in space for using things like what are called tissue chips or organs on a chip, where you could actually send a small simulated liver to space and then have it change in the space environment, those cells change in the space environment, and then expose those cells to medications that are normally metabolized by the liver and see how that metabolism changes in the spaceflight environment. So our knowledge in that area is very limited. It's an interesting area for future research, but there are some new technological ways that we may be able to perform that research that have never been enabled before.
Great. When every minute counts and your next doctor's consult is light seconds away, you need smart decision support. Your work on spaceflight clinical decision support highlights data overload as a key barrier. Can you share an instance where the system's recommendations contradicted human judgment and what that taught you about human machine collaboration?
So the project that you're describing is one that was very much in the prototyping phase. And so it was never applied clinically in spaceflight. But
Mhm.
one of the things that we did learn in doing that project, though, was that the oftentimes when you're trying to come up with clinical decision support tools, they often want to follow specific rigid protocols. And part of the challenge that we have with humans is that there's always a time when the protocol is wrong or someone has an alternate problem or another symptom that was not anticipated as part of the protocol, and it confounds or confuses the machine, if you will. And so the challenge that we're going to have going forward is that every clinical decision support system that we could potentially fly to space is only going to be applicable in a certain number of instances and circumstances. And so a great example here is we detected a number of years ago a blood clot in space. Well, prior to that, no one had even known that a blood clot was possible in space. So if you had programmed a clinical decision support on all the conditions that you anticipated in the space flight, you would not have included a blood clot in the condition list. And as a
Mm-hmm.
result, if a person developed symptoms of a blood clot, the computer would have been unable to identify a blood clot as a possibility because it wasn't programmed in from the beginning. So I think that the reality is that all these future systems that we're going to have are going to be very useful for the things that we anticipate, but they may not be as useful for the things that we do not anticipate. And that's where the human side of medicine is going to come in. We're going to have either on board and on Earth people who can help to problem solve and troubleshoot in a scenario that was not anticipated.
Okay. Um, let's talk about managing a full-blown medical emergency. You're on a Mars mission, millions of miles and many minutes of communication delay from Earth. An astronaut suffers a severe traumatic injury during an EVA or develop acute, let's say, appendicitis. The life limb mission paradigm often comes up in extreme medicine. Can you walk us through the kind of incredibly difficult ethical and practical decisions you, as the crew medical officer of the flight officer, might have to make, where the best medical option might be impossible and the mission objectives could weigh heavily?
It's I used to teach a graduate course when I worked at George Washington University, and we had a session every year called "You Are the Flight Surgeon," and in that session, I would propose this scenario to my students, and it was we talked before about someone getting a bladder infection, which became a kidney infection, which became a blood infection. So that's called sepsis. And sepsis often requires a significant amount of intravenous antibiotics and a lot of intravenous fluids, and maybe requires medications to maintain your blood pressure. And the challenge in these circumstances, and if you were on a mission to Mars, for example, that I would pose to my students is, what do you do if you're doing all of these treatments for someone who has sepsis and they are not improving?
Mm.
And you do a calculation to look at how much antibiotics you have left. And you realize that if you continue to keep giving this person antibiotics who's not improving, you then won't have enough antibiotics for another one of these events if it occurs later on in the mission. And that type of scenario is very realistic, and one that you could absolutely face on this type of mission. And it's difficult from a medical perspective because you're obviously not being successful in treating this patient. But from an ethical perspective, from an interpersonal relationship perspective, from a mission perspective, what if the person who is sick is critical to the success of the mission and you have to save them at all costs? You may use up all of your medicines to do that, but you then anticipate or you then increase the risk of illness or injury for your other crew members later on in that mission. There's no right answer to these scenarios, but I think the key thing when anticipating these missions is to consider these types of scenarios and to essentially tabletop or role play them to different conclusions. If you decide to withdraw care on the one astronaut to save the medicine for everyone else, do you now have a palliative care option on board for that astronaut? If you decide to give them all of the antibiotics that you have, do you have a means of generating or making more antibiotics on your mission? Could you actually create pharmaceuticals in mission for different reasons? And so you could create or new technologies or capabilities that you put on these missions to anticipate these types of events. So the reality is that there's no right answer, but by working through all the different possibilities, you can make a more robust medical system going forward, or at the minimum, you can anticipate these difficulties or challenges, and you can work with the crew members and the astronauts before they go through some of these scenarios so that if and when it happens, they are then better prepared to deal with it.
Okay. Beyond just adding more physical shielding, which has its own penalties, what innovative or perhaps even unconventional countermeasures, maybe drawing from the fields like material science, genetics, or even AI driven predictive modeling, what unconventional countermeasures do you believe hold the most promise for genuinely protecting astronauts on those long transits or long duration missions?
And since you mentioned shielding, I'm assuming we're talking about radiation.
Radiation shielding,
Yeah,
yeah.
absolutely. So I think that there's lots of really interesting ideas about using almost like Star Trek kind of shielding with plasma and different things around the vehicle to try and protect from radiation. There's been discussions about having double walled vehicles and having all of your water stored in the walls of the vehicle and that being a radiation protection as well. But I think that right now we're living in an age where there's lots of different new medical countermeasures that are being created for radiation exposure. And they're being created on Earth for cancer patients who are undergoing radiation treatments. And so there's a number of different nutrition and biochemical and medication type countermeasures for radiation exposure that may have lots of applications in spaceflight. And so I think that going forward, it'll be interesting to see if we can't stop the person from being exposed to radiation, can we reduce the impact that the radiation has on them
Mm-hmm.
in mission? And then long term, if we know that there's going to be an increased cancer risk from that radiation exposure, but that cancer won't develop until they're back on Earth, then we can have more advanced screening and treatment options on Earth to try and detect those cancers at really early phases and then treat them. So, in a perfect world, you stop the exposure. But if you can't stop the exposure, how can you mitigate the impact of the exposure?
Okay. You've been involved with developing and testing advanced medical technologies like the Autonomous Medical Officer Support, AMOS, the ultrasound system. Looking ahead, what are one or two game changing medical technologies currently on the horizon that you believe will most dramatically improve an astronaut's chance of surviving a severe medical emergency in deep space? And what specifically makes them so transformative?
So the AMOS project, thank you for bringing that up, the Autonomous Medical Officer Support Software. The AMOS project was, I think, an example of how we know that people on deep space missions are likely going to have to perform complex medical procedures. And we have no guarantees that the people on board will have extensive training in those areas. And so what we really wanted to determine was how much can you support someone who has minimal training in a procedure? In this case, it was kidney and bladder ultrasound. How much can you support them with software to accomplish a task that is normally done by a person who has hundreds of hours of training? And the reality is that there are so many tools that are being developed now that can assist people to perform procedures. Every time I want to fix something in my house, I watch YouTube and it helps me figure out how to fix it. Um, but going forward, we can do much better than that. We can have technologies that can use computer vision to see where your hand is holding the ultrasound probe. And we
Okay.
could have a computer autonomously giving you inputs to optimize that image by telling you how to move your hand and where to move your hand real time in order to get the best possible ultrasound picture. So AI, computer vision, software support for procedures, that kind of stuff, I think is going to be enormously helpful for spaceflight. And we are starting to see that kind of technology being incorporated into medical devices here on Earth. So there's an ultrasound device on Earth called the Butterfly IQ ultrasound. And that technology actually has guidance software built into it. So the ultrasound will help you to use the ultrasound to get the best possible picture. And so there's any number of medical procedures that may have to be done in space. But
Mm-hmm.
if we could have really capable onboard support tools for all of those procedures, then we can walk people through almost any medical life-saving event.
I would like to linger here a little bit more and follow up. The idea of performing complex procedures, perhaps even surgery, in microgravity with limited resources seems almost unsurmountable. What are the most daunting practical hurdles from fluid dynamics to instrument handling to altered wound healing that need to be overcome for in situ surgical or advanced trauma care to become a realistic option?
Yeah, it's there's a lot of interest in space surgery. And part of the challenge, I think, when we even just talk about space surgery is that the moment you say surgery, most people in their mind picture an operating room and all of the equipment and all the people and all the stuff that is needed for an operating room to perform. And what we've seen from military examples is there are ways to set up field surgical capabilities
Hmm.
that basically come out of nothing but a backpack.
Yeah,
And
MASH.
yeah, exactly. It can be done, um,
Hmm.
but we have to think differently about these types of capabilities. And so this is where I think that there are some really interesting robotics technologies that may be really influential. And when we talk about robotic surgery, again, most people envision machines that are the size of a refrigerator. But there was recently a small surgical robot that was flown to space station that has a very small footprint and could be useful for either autonomously performing procedures or using them in an assistive way. And there's even some surgical robotics where they're talking about implanting or placing small robots inside the abdomen so that you could perform surgery inside the abdomen without opening the whole thing up. There are opportunities for things like robotic arms that can place intravenous lines into people in an autonomous way using
Hmm.
ultrasound. So there's lots of different capabilities that are in development that I think will enable us to do at least small surgical procedures in space
Hmm.
or some more complex or invasive procedures in space that we've never done before. But all of those things are going to be very difficult in the microgravity environment. They might end up being a lot easier on a celestial body because we may find that 1/6 gravity or 1/3 gravity is sufficient for containing and maintaining those fluids and sterile areas. And that may enable us to do more complex procedures in space that we can't do in the microgravity environment.
So, what paradigm shifts in medical thinking or technology are essential?
I think that the biggest paradigm shift is the idea that that robotics and computer technologies can augment and assist us from a medical perspective. I think that there's been, especially in the medical field in general, I think when you talk about artificial intelligence, for example, a few years ago, there was a pioneer in artificial intelligence who said, I don't know why we're training radiologists anymore because AI is going to do all of this in a few years. And even he now has gone back and said, I was wrong when I said that, but the best doctors in the future are going to be doctors who use these advanced technologies to augment their capabilities. And I think that the paradigm shift that we have to overcome is that using these assistive technologies is not cheating, it's augmenting and it's making us better in the future than we are today without them.
I'm sure your students now going to be happily justifying using ChatGPT.
I use ChatGPT. It's great. It's
Yeah,
great.
it is.
But it's about how knowing how to use a tool and when to
Hmm.
use a tool.
True.
And an analogy I heard a little while ago was that a microwave is great for cooking, but you're never going to make a grilled cheese sandwich in a microwave because it would be
Yeah,
disgusting. So
true,
how do you know when to use the tool and how to use the tool? That's
true.
important.
Okay. Finally, Kris, looking out over the next decade, what are the most exciting or pressing research questions your team is aiming to tackle? And what specific breakthroughs in space medicine do you believe are absolutely critical to enabling humans' ability and ambition to become a multiplanetary species?
So right now, UT Health, one of the things that we are focused on is we really are starting to, all of our fellows do training in with commercial space companies. And one of the reasons that that's so important to us is because commercial space companies want to fly lots of different people to space with lots of different medical conditions. And so historically, as an example, if you have a kidney stone, you would have never been selected as an astronaut because that is an exclusion criteria for selection. But in the future, we want to be able to fly lots of people to space with lots of different conditions. And I think that the area that we are focused on is how do we safely determine who can fly to space? How do we find ways to say yes to as many people as possible to fly to space with medical conditions? How do we optimize their health before they go to try
Hmm.
and prevent something bad from happening? And then how do we make sure that if something bad does happen, that we have anticipated it properly and we have the capabilities on board and the knowledge, skills, and abilities to treat those problems in space without having to evacuate people back to Earth? And that's the area that I think is game changing going forward. And one of the
Hmm.
reasons that we're focused on commercial spaceflight, because that desire to fly normal people to space, if you will,
Hmm.
is how we have our current aviation industry. We don't medically screen out everyone who gets on an airplane, but if medical events do occur, there are capabilities on board to treat those events when they happen. And so our spaceflight paradigm has to start shifting towards that type of aviation paradigm. But that's not going to happen unless we start to really understand what it takes medically to fly normal people to space, and anticipate the needs that they're going to have in space from a medical perspective.
Um, do you have a favorite sci-fi book?
I have lots of favorite sci-fi books. The one of the ones that I use a lot when I'm talking about medical stuff is The Martian. Um,
Okay.
it's a great sci-fi book,
Hmm.
bar none. But from a technological perspective, from a research perspective, he really did his homework,
Hmm.
Andy Weir. So I think that I love that book because I think it realistically tries to look at some of the challenges of human spaceflight and some of the technology needs for human spaceflight. But I will say I had one beef with that book, and that's that it at the end of the book, when someone needed a medical imaging test, they did an X-ray, and we've never had X-ray in space. We've always had ultrasound, and so you could have used ultrasound for that thing. However, SpaceX just flew the first commercial medical X-ray device to space
Oh,
and did
okay.
the first X-ray in space, and it worked. Um,
Okay.
so, so maybe Andy Weir was just anticipating that future technology capability, but the it's just a fantastic book and always entertaining.
Before we wrap up, is there anything else you'd like to share with our audience or advice you'd like to share?
I think that the one thing that I would say is that the I've mentioned this a few times now, but the reason that I'm so excited about some of the work we're doing at UT Health Houston is because it is truly interdisciplinary, and I think that the podcast that you're doing and the work that you're interested in is going to require people from lots of different fields and lots of different domains. And I am not an engineer, but my work at NASA, I had to learn how to communicate with engineers. And one of the things that I've discovered in the space community is that there are a lot of people in the space community who are really interested in human spaceflight, and we need all of those people and all of their inputs to make it successful. And so the interdisciplinary nature of human spaceflight is that no matter what your background is or your interest is, there's an application for your knowledge and expertise in human spaceflight. And so that to me is kind of the one message that I would always share with people is that if you're passionate about this domain and this area, whatever your background is, I'm certain that there's a meaningful contribution that you can make to it.
Hear, hear. Kris, it's been an honor to have you here. Thank you so much for sharing your insights and expertise.
Thank you, Omar. It's been great. Thank you.
To everyone else listening, this is the Omar Aleli podcast. Thanks for joining us and keep exploring.